Hi, in today's webinar, we will be talking about recognizing and responding to human trafficking in a healthcare context. Our objectives for today are to define human trafficking and recognize how victims may come into contact with healthcare providers, such as ourselves, learn to identify potential human trafficking victims in a clinical setting, and identify promising practices for assisting a patient who may be in a potential trafficking situation. Let's start by defining human trafficking. So what is human trafficking? There are actually two types of human trafficking that we'll be talking about today: sex trafficking and labor trafficking. Sex trafficking is the most common, which is the recruitment, harboring, transportation, provision, or obtaining of a person for a commercial sex act, in which that commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act has not attained 18 years of age. Labor trafficking is the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. This is the action means purpose, or AMP model. This model can be used to describe the elements of human trafficking. Cases that are considered severe forms of trafficking in persons involve three elements: action, means, and purpose. For the action involved, we have recruiting, harboring, transporting, providing, or obtaining. The means is by force, fraud, or coercion. Force is by physical assault, sexual assault, or confinement. Fraud includes false promises about working/living conditions and withholding promised wages. Coercion are threats of harm or deportation, debt bondage, manipulation, or confiscation of documents. And the purpose is either a commercial sex act or labor or services. So where does trafficking occur? Sex trafficking can occur in commercial front brothels, hotel-motel based, online exploitation, street-based, which is the most common, residential brothels, escort services, truck stop based, and hostess/strip club based. Labor trafficking includes domestic work, traveling sales crew, restaurant, agriculture, and landscaping businesses. So why does trafficking exist? Human trafficking is a market-driven criminal industry that is based on the principles of supply and demand, like drugs or arms trafficking. Human trafficking is fueled by a demand for cheap labor, services, and for commercial sex. There is low risk to the trafficker. Human traffickers perceive there to be little risk or deterrence to affect their criminal operations. In other words, there is someone else doing the work for them. Factors that include low risk are lack of government and law enforcement training. So in other words, perhaps law enforcement are unable to identify potential victims. Low community awareness. It could be ineffective or unused laws, lack of law enforcement investigation, scarce resources for victim recovery services, and unfortunately, social blaming of victims. There are also high profits. When individuals are willing to buy commercial sex, they create a market and make it profitable for traffickers to sexually exploit children and adults. Unfortunately, human beings are able to be used over and over again, whereas in drugs or arms trafficking, you have to create the material, you have to move the material, you have to keep reproducing a product, whereas a person can be used for many hours at a time. Trafficking in healthcare. Access to medical services. In one study, almost 88% of trafficking victims reported accessing some kind of healthcare service during their trafficking situation. Of these, about 68% were seen at the emergency department. And there's a quote here by a survivor named Lauren. She states, "During the time I was on the street, I went to hospitals, urgent care clinics, women's health clinics, and private doctors. No one ever asked me anything anytime I ever went into a clinic." So when do victims seek medical services? As you can imagine, in an emergency or perhaps after an assault, after a workplace injury, for gynecological services such as routine checkups, it could be symptoms of an STD, STD treatment, for prenatal care, it could be for routine mental health services, addiction treatment, pre-existing conditions, or other healthcare related issues. Barriers to victim self-identification. Many victims will not self-identify as a victim. They will experience shame or guilt. They may fear retaliation by the trafficker, especially if they are monitoring the movement. They may fear arrest, deportation, or some kind of mandatory reporting. They may also fear report to social services. And they may also lack an understanding of the U.S. healthcare system. Recognizing trafficking victims. Any one of us may come into contact with a potential victim. So anyone in customer service, our practice management, frontline staff, anyone in the back office, including clinical, nursing staff, lab technicians, support staff, and providers. Indicators for labor trafficking. Indicators include workplace abuse and restrictions. Perhaps the patient owes a large debt and they are unable to pay it off. They may not be in control of their ID or documents. If they were recruited through false promises, and or if they are unpaid or paid very little. So if we have a patient who is perhaps diabetic and needs to return every 3 months, we know that the patient has a job and we know that they are currently working. However, they state that they don't have money for a follow-up, they don't have money for their medication, or perhaps they state that their transportation is limited. So it's not one of these indicators that can label a potential victim. It's looking at the entire picture. Health indicators for labor trafficking victims. You may see things like musculoskeletal and ergonomic injuries, malnutrition, dehydration, especially in the summer or in warm weather, lack of routine screening or preventative health, untreated skin conditions, injury or illness from exposure to harmful chemicals. When we're talking about behavioral indicators, it could be things like anxiety, paranoia, an inability to make decisions independently, and they may have a flat effect. Indicators for sex trafficking. You may see evidence of a controlling or dominating relationship, signs of physical and or sexual abuse, lack of control of their own finances, signs of alcohol or drug use, and inappropriate dress for weather. Health indicators for adult sex trafficking. Physical indicators include multiple or recurring STIs, a high number of sexual partners, trauma to the vagina or the rectum, signs of physical trauma, suspicious tattoo or branding. Some behavioral indicators include depressed mood or flat affect, anxiety, frequent emergency care visits, unexplained or conflicting stories, signs of alcohol and drug use, and if they speak using terms like the life. Health indicators for child sex trafficking. Physical indicators include pregnancy at a young age, evidence of abortion, early sexual initiation, trauma to the vagina or rectum, a high number of STIs or UTIs, And again, suspicious branding or tattooing. Behavioral indicators include a history of running away from home or being in the foster care system, truancy, or maybe they stop attending school, highly sexualized behavior or dress, angry and aggressive with staff, depressed mood, flat affect, and or signs of drug or alcohol use. The impact of trauma. Some victims may be experiencing post-traumatic stress disorder. They may have recurring thoughts or relive the event, have recurring nightmares or trouble sleeping. They may feel detached and withdrawn, and they might be easily startled. They may also have cognitive impairment, such as the inability to concentrate, memory disruption, unable to recall things, unable to recall events accurately. Memories may be triggered by related sensory information. Trauma bonding. A lot of victims will demonstrate or what we refer to as Stockholm syndrome, which is a loyalty to the trafficker. They may have an unwillingness to report or testify against the trafficker, and they may even return to the trafficker. As you can imagine, the trafficker in the situation is the person who gives them a little bit of hope. It's the person that is allowing them to live, and so the victims are grateful for that, but they are unable to make the connection that this is also the same person who is causing the trauma. Responding to trafficking situations. Our primary goal, if we have a patient that presents with one or more trafficking indicators, is to ensure that the primary health and safety needs are met. There may be other things to consider, such as mandatory reporting. We may need to contact the NHTRC for further resources. The patient may not wish to report, so we may have to discuss with the patient what we are mandated to report. But we can also provide referrals to the NHTRC. For the initial assessment with our patient. The assessment should be conducted individually with the patient in a safe location. Again, the primary goal is to assess the patient's immediate safety. We should use language that the patient can understand and not ask for any unnecessary information. We should be taking a victim-centered approach. In other words, we are here to meet their basic needs. We want to reassure the potential victim that we are here to help. We want to build trust and rapport with the victim. We want to be conscious of our language, remain sensitive to power dynamics, and avoid re-traumatization. We also may need to coordinate with other providers for basic needs, legal needs, emotional and social support, and safety and security. Let's talk about myths and misconceptions. So be thinking about these as we go through them. Nearly 80% of human trafficking is for sex, and 19% is for labor exploitation. True or false? You probably guessed true, and that was correct. After sex trafficking, the most common form of human trafficking is forced labor. Researchers argue that as the economic crisis deepens, the number of people trafficked for forced labor will increase. Human trafficking is another term for human smuggling. And that is false. Smuggling is a crime against a country's borders, so human trafficking is a crime against a person. Each are distinct federal crimes in the United States. While smuggling requires illegal border crossing, human trafficking involves commercial sex acts or labor or services that are induced through force, fraud, or coercion, regardless of whether or not the transportation occurs. A woman that comes to your clinic cannot be a victim of human trafficking because she's obviously not being held against her will. What do you think about this? True or false? The answer is false. A person can be a victim of human trafficking, even if there are no elements of physical restraint, physical force, or physical bondage. Being kidnapped, locked up, or chained is not required to be a victim of trafficking. People can be held through psychological means. This misconception is one of the biggest reasons more victims of human trafficking are not identified. Both men and women can be victims of human trafficking. True or false? That's true. Men and young boys are also trafficked, and they do often get much less attention than trafficked women do. In part, that's because it's very difficult to get young boys out of trafficking, especially sex work, because the activity generates the kind of quick money that cannot be made anywhere else. A trafficking victim might be free to go places, appear happy, and even advertise for more customers. True or false? That is true. Again, human trafficking is about exploitation, not movement, not restraint. Human trafficking can be compelled by force, fraud, deception, abuse of power, or coercion, which includes psychological coercion. Furthermore, prostituted women are required to appear happy. Sometimes trafficked individuals are compelled to advertise because they are under pressure to bring in money for their trafficker or pimp. Pimps have been known to tattoo or brand their victims. We've talked a little bit about this earlier, but yes, that's true. Many pimps will tattoo or brand their victims to mark them as their property. Some examples would include dollar signs, the trafficker's name, and possibly barcodes. And again, it's not one of these indicators. It's not one sign that indicates that your patient is in fact a human trafficking victim. It's looking at all of the indicators as a whole. If a girl is 16 and she has willingly decided to work for a pimp that does not use force, fraud, or coercion in any way, she is a child prostitute and cannot be considered a victim of human trafficking. True or false? That's actually false. So any child that is being sexually exploited is automatically considered a victim of human trafficking, even if there's no force, fraud, or coercion. Consent is irrelevant. Since a person under 18 cannot legally consent to prostitution, there's no such thing as a child prostitute. The more appropriate term is commercially sexually exploited child. You can build awareness about the trafficking of children by insisting that journalists, law enforcement, government officials, and others, such as healthcare providers, use the correct language. Human trafficking victims always come from situations of poverty or from small rural villages. As you can probably have already guessed, that is false, although poverty can be a factor in human trafficking because it is often an indicator of vulnerability. Poverty alone is not a single causal factor or universal indicator of a human trafficking victim. Trafficking victims can come from a range of income levels, and many may come from families with higher socioeconomic status. Sex trafficking is the only form of human trafficking. Well, we should know this by now. That's false. We know that there are two types, sex trafficking and labor trafficking. Human trafficking only occurs in illegal underground industries. True or false? That is false. Trafficking can occur in legal and legitimate business settings as well as underground markets. Human trafficking has been reported in business markets such as restaurants, hotels, manufacturing plants, as well as underground markets such as commercial sex and residential brothels and street-based commercial sex. If the trafficked person consented to be in their initial situation or was informed about what type of labor they would be doing or that commercial sex would be involved, then it cannot be human trafficking or against their will because they knew better. That is false. Initial consent to commercial sex or labor setting prior to acts of force, fraud, or coercion, or if the victim is a minor in a sex trafficking situation, is not relevant to the crime, nor is payment. So something to remember is that there are at times when trafficking victims do know that there will be commercial sex involved. However, sometimes what they do not know is that they cannot say no, even if they are pregnant, even if they are on their menstrual cycle, and may be forced at times to perform without using any kind of protection. Foreign national victims are always undocumented immigrants or in this country illegally. That is false. Not all foreign national victims are undocumented. Foreign national trafficked persons can be in the United States through either legal or illegal means. Although some foreign national victims are undocumented, a significant percentage may have legitimate visas for various purposes. LGBTQ youth are at especially high risk for trafficking victimization. That is true. LGBTQ youth who have been thrown out by their families are also at especially high risk for trafficking victimization. Vulnerable youth who are looking for love and basic necessities of life, including food, shelter, are easy prey for human traffickers who will offer false promises, false affection, a place to stay, at least for the night. Their chances of being trafficked into prostitution increase every day while living on the streets with minimal resources and protection. Victims of human trafficking will always immediately identify themselves as victims to potential rescuers such as ourselves and are desperate to escape. True or false? That is false. The reality. Often victims do not identify themselves as trafficking victims due to a lack of knowledge, lack of trust, self-blame. It could be instilled fears or consequences set forth by the trafficker. Sometimes victims have a traumatic bond with their captors and they want to stay. Sometimes it takes years of healing before victims understand that they were victims, that they were coerced, and that coercion is not the same as consent. Sometimes victims will blame themselves, as stated before, and again, sometimes it takes years for them to obtain the resources in order to leave. Remember to use the NHTRC or the National Human Trafficking Resource Center. The toll-free number is 1-888-373-7888. You can also visit them online at www.traffickingresourcecenter.org. NHTRC confidentiality. All communications are confidential unless the caller provides permission to be connected with law enforcement or a service provider. If the caller threatens harm to themselves or someone else, or is in a life-threatening situation. Medical providers should abide by all relevant HIPAA or confidentiality restrictions. And lastly, calling the NHTRC will not fulfill any applicable mandatory reporting requirements. But they can facilitate a report to law enforcement trained on human trafficking. And just a note before we go, you're always welcome to give me a call if you have any questions. And some of the resources that we've pulled from today are books such as Girls Like Us by Rachel Lloyd. This was a really great book about a victim who documents her trafficking situation. And she actually came to, I believe, Brooklyn and created her own organization for trafficking victims. Also, Somebody's Daughter. It's a book by Julian Scheer. So also a really great book about a young woman who helped take down one of the most notorious traffickers, in the United States. We also have another called The Natashas by Victor Maloric. Also a really great one. This one details human trafficking internationally and more specifically Eastern Europe. And then lastly, Trauma and Recovery by Dr. Judith Herman. This is also a really great book. It details post-traumatic stress disorder and trafficking victims, victims of domestic violence, and prisoners of war. So anyway, again, if you have any questions, don't hesitate to reach out to us. We're always available if you have any questions. Thank you.